Welcome to Capitol Report with State Representative David Bly. I'm Mike Howard. Representative, thanks for coming into the studio.
Welcome.
We're at the midway point of the 2010 session. We've talked a little bit about some of the jobs initiatives that you've worked on, but there's also been hard work throughout the session to deliver on a balanced budget and to work on healthcare issues. So let's talk about some of that work.
Well, we did sign into law, and the governor did sign the budget cuts, which takes care of about a third of the problem that we have, and leaving off the health care and the education, K-12 education issues that we'll deal with later. We do need to cut back in these difficult times. I did not vote for the ultimate bill, knowing it would probably pass anyway, but I had made a commitment to college students in my district that I would not vote for cuts to the state grant program, and in committee we had worked out a way where we wouldn't have to make those cuts, and I was very disappointed that through the conference committee and work with the governor that that solution was not accepted, and they made a decision to cut the state grant program. It's not a severe cut, but it's the first time that program has been cut, and we certainly don't want to see a retreat from the aid that we give to college students as they pursue their college education.
You know, in this difficult time, that program's more valuable than ever.
Yeah, absolutely. And you know, families are harder hit by the economy, and making it's a tough decision to continue the education payments that they have to make. And we were trying to make sure that they could be helped in some way. There
are some priorities in that bill that I know that you're supportive of, and one of those is lessening the burden on local government as far as their share of the cut. And I know there's a stark difference between the governor's original proposal and this bill on LGA.
I think we were able to deliver a cut package that was better than half what the governor was recommending. So hopefully that will be a help to cities and counties, and they won't see as deep a cut as they would before, and they won't be required to necessarily pass as much on property taxes to their constituents. So hopefully that was a help to them, and you know, we recognize in a difficult time we do have to make cuts, and we're trying to make that as fair and balanced as we can under the circumstances.
Well, one reason that healthcare was kind of left out of that initial bill is that there's a lot of interaction going on with the federal healthcare reform and then also the general assistance medical care solution.
Right, yes, and we can't, I mean, taking care of general assistance does involve a cut to health care, and certainly providers in hospitals, clinics will see that in the reduction in amount that they will get for that program. They're being required to kind of figure out a way to reform what they do that may reduce their costs, but that's going to be a difficult charge. And at least we were able to keep the program alive so that maybe in better times we'll be able to revive it and make sure that they get reimbursed for the care that they provide to that population. But going forward, we'll be looking at you know, what the federal law will do to help us out with our problem. We're still waiting on some funding that is kind of promised but hasn't made its way through the federal system, and the governor has included that increase in funding in his budget, and we probably will put it in ours. We're hoping that we can really limit the cuts to hospitals and nursing homes. Some of us are even looking for ways to try to find some revenue to stop the cuts to nursing homes. Year after year, they've experienced dramatic cuts, and it goes to reducing the wages of the workers there, and we really value their ability to stay in their jobs and do a good job for the senior citizens that they serve.
Well, I know nursing homes is an issue that you focused on in your time with the legislature and have offered a number of bills and have worked to you know, make sure that the nursing homes in your area are treated fairly.
Yeah, and I can't forget that also the programs for the disabled that that I also hear a lot from, and we want to make sure that they are protected and they've been cut in the past, and we've tried some efforts to hold back on some of those cuts, but it's tough in this environment for them to continually have to tighten their belts, and certainly necessary. They provide necessary services, and we want to make sure that they can continue.
So a lot of progress this session, but still a lot more work to be done, and so I'll ask you to come back, especially as these healthcare issues get worked out, and hopefully we can reach a a balanced budget and a balanced solution.
Yes, I hope so too.
Thanks for joining us.
Thank you.
This has been Capitol Report with State Representative David Bly.